Hello, I'm Dr. Bang, your hair wizard. Glad to meet you. Before the surgery, the main concern for patients is the cost. They worry about the cost, then the pain, and if it will be too noticeable. And then, at 1 month, they worry if it was a success or a failure. So, graft survival means that after planting, it settles and we wait for it to regrow. Sadly, hair follicles don't just grow continuously, they shed once before regrowing. So, we commonly refer to this period, when hair falls out and disappears, as the shedding phase. It's an uncertain time where I can't expect much. While this shedding phase is often explained as months 2, 3, or 4, and you might know that, we find that if shampooing starts sooner and graft survival is hastened, the shedding phase can be 1 to 2 months. So, if you observe our patients, you'll see significant hair shedding at the 1-month mark. When I consult with patients, I actually ask them to shampoo diligently so that over half of their transplanted hair has shed by their 1-month follow-up. At the 1-month mark, hair is actively shedding. Some spots are already bare, and others feel completely smooth. Patients get very anxious during this time, and they become very curious. Is this okay? Even if you know it logically, it's normal to feel anxious when transplanted hair disappears. To conclude, it's perfectly fine. Sadly, as the wound heals, the hair pore often vanishes. These hair pores are essentially newly formed spots. Therefore, you often can't even see them. So, even if the transplanted area appears smooth and clean for 2 or 3 months after surgery, the hair will grow back without issues. There's truly no need to worry. As I mentioned earlier, I said that this shedding phase typically occurs a bit later. There are several theories. One is that poor blood circulation in the transplanted area leads to hair shedding, and regrowth is somehow impaired or delayed. Another theory suggests that if the transplant is performed flawlessly, the follicle doesn't realize it has moved. But I feel that it is truly just the nature of the hair follicle. Just as people differ, follicles vary by location and characteristics. Some areas wouldn't shed despite shampooing. But when we observe them over time, they do eventually fall out. So even at 3 or 4 months, they can still fall out. And there's no need for you to try to pull them out yourself, because I believe our bodies know how to regulate themselves. If the shedding is a bit slow, just accept it and continue to shampoo diligently, massaging the area gently. Today, we're talking about the most curious, anxious time. 1 month after surgery with no cosmetic improvement. During this normal shedding phase, it's fine for transplanted hair to shed, so there's no need to worry. Just continue your diligent aftercare. Thank you.